Hello guys, today we will be presenting hepatitis B. Uh, this is our group, Richard, Alan, myself, Walden, and Raquel. Raquel. Okay, so I'm going to be controlling the slides.
Okay, so hepatitis B is a viral infection that affects the liver. It is caused by hepatitis B, which is a virus, or HBV, which is a DNA virus. It spreads through the blood, sexual contact, and from mother to baby at birth. The symptoms can appear about 60 to 150 days after exposure, so they may not show right away. And hepatitis B is highly infectious, but it is not spread through casual contact, like for example, hugging or sitting beside someone. Next slide, please. Okay, so for infection prevention and control, nurses should use a routine practices when caring for patients with hepatitis B. For example, using hand hygiene is very important before and after patient care. Gloves should be worn when touching blood or body fluids. If there is a risk of splashing, a mask or eye protection should be used. A gown is needed if clothing or skin may be exposed. And nurses always need to handle sharps safely to prevent needles or anything that could be injected into their skin as well.
So this slide is based on patient and visitors measures. It's about dedicating like different instruments like blood pressure cuffs or like moving the patient, like transporting the patient to another unit. Like you're supposed to notify them of like the patient is diagnosed with like hepatitis B, and there's a no sharing rule, meaning like stress that razors and toothbrush and nail clippers must never be shared. The surface, you should always like sterilize the surface and stuff to prevent the spreading. And it's always good to demonstrate like routine hygiene practice, like always wash your hands after, in contact with the patient or even before. So next slide, that's it. So under the medical treatment, you have like two major, which is the acute phase, and then the chronic phase. So the acute phase, it focuses on like making the patient like rest and maintain like sufficient nutrients like intake. Common measure like they do monitor or surveillance for like biometric, which is regular ALT and ALS, which is the liver enzyme, which like indicate like the HBV virus is present. Imaging, ultrasound, alpha fetoprotein, that's AF, every 6 months for cancer screening, right? And for education on the medication, right? The treatment, stress that to prevent the viral flare-ups, like to abstain from medication like acetaminophen, like stay away because it could cause flare-ups. And then screen for hepatitis A immunity. So that's it. How much?
Nursing diagnosis, some of the nursing diagnosis. Risk for infection transmission, that is the presence of virus in blood, fatigue, impaired liver function, increased energy protection, Implant nutrition. Implant nutrition is anoxia and risk for the impaired skin integrity and deficient in knowledge, lack of information about diseases, and anxiety and acquired pain. Acquired pain is liver inflammation. That is the nursing intervention to specific interventions. Follow strict safety protocols for SARPs. Do not recap needles, dispose of SARPs immediate proper container. Educate patients on preventing transmission. Maintain proper hand hygiene and avoid sharing personal items. Example, toothbrush and blades. Some things. Practice safe sex use protections.
So hello everyone, I'm Rakib. So I'm gonna presenting the nursing diagnosis 2. So the fluid related to the decrease the metabolic energy production and the inflammatory process of the liver as evidenced by patient reports of the lack of energy, inability, and to maintain usual routines and increase the needs for the rest. Next please. And the nursing intervention for the diagnosis 2 is encourage energy conservation, like the cluster care and the scheduled rest period between the activities. Assist with the daily activities as needed to avoid overexercise and promote diet management. Offer small, frequent, balanced meal in tolerant and monitor the intake and encourage hydration to the support recovery.
Thank you.
Thank you so much, and this is all I'm referring.